Welcome back to the Hometown Healthcare Series, where we are interested in innovations and perspectives in community healthcare. I'm Charlie Barnes IV, CEO of Barnes Healthcare Services, also known as Barnes Drugstore in my hometown, Valdosta, Georgia. Today, we're going to talk about the role of the pharmacist in healthcare. We are a pharmacist-founded organization. For my forefathers, 3 generations of all pharmacists. I am not. I am a business owner today, but the pharmacist plays such a pivotal role. What we like to say is they are the most highly educated. They're all doctors. A lot of people may not even know that. They're PharmDs. They're all doctors now. They've been doing that since the early 2000s, I think. And they don't get as involved in healthcare as they should. So they're the most highly trained, underutilized healthcare professionals, in my opinion, in my understanding, that we have out there. And we as a country and as many states have expanded the roles of advanced nurse practitioners, right? Our nursing teams out there and their ability to do work, and that's been great. But pharmacists, in many occasions and most occasions, are or even more highly trained or have more education and background than a lot of our nurse practitioners do. Nothing against, of course, nurse practitioners. I think they do a phenomenal job. But we don't get involved in healthcare like we should. Now, did you know that I would say, and this is probably a very conservative number, 86%, 85, maybe it's 90% of interventions, doctor interventions, involve prescribing a medication. So anytime that a doctor intervenes in someone's care because they see something's off and they have to do an action, an intervention, the result is they're prescribing a medication. So the pharmacist is such a critical part of that. And the pharmacist is seeing and communicating with that patient every single month, or somebody in the pharmacy is. They're getting their medications filled. A very sick patient is going to see their physician on average 3.5 times a year. That same very sick patient is going to interact with their pharmacy 35 times in a year. Can you imagine what we can do to move the care plan forward in the world of pharmacy? So I see pharmacy as being a critical piece in the healthcare continuum and how we move into the future of healthcare, the value-based function of healthcare, not the volume healthcare, the incentivized for a service, a surgery, diagnosis healthcare, but actually to get to the root cause and to actually move things forward in healthcare. We're looking to do that here. There's other pharmacies that are looking to do it as well. There's a lot of great independent pharmacies out there. There's a lot of great pharmacists out there, but we have to pave the way. We have to create the future to make that happen, and not only to help educate patients on their medications, to help them adhere to their medications, to help remove the barriers to be able to have their medications, but the goal is to get them off their medications. And you do not hear that very often out there, is how do we move patients from where they are today, not only to a state of better health, and what is the pharmacy's role in that with the other partners, the primary care physician, if there's other, home health nurses, there's specialists, there's all kinds of people can be involved. How do we move them to a place where they're in such a stable state that we can get them off their meds? And the pharmacist plays a critical role in that. And when that's our role, and that's what we believe in, and that's what we're moving towards, is doing more and more of that type of work. So again, thank you for joining us today, and look forward to speaking to you again. Take care.